Hello, everyone. My name is Dr. Elizabeth Kolawole, and I will be discussing managing and balancing hormones. My previous recording was a little messed up. It had some technical difficulties, so I'm going to re-record this talk for you. I hope you enjoy it, and I hope you discover the world of hormones and all that it entails, and I hope you get something out of it. Thank you so much. All right. What is a hormone? So a hormone is a class of signaling molecules in a multicellular organism that are sent to distant organs or tissues by complex biological processes to regulate physiology and behavior. That was a mouthful, okay? That was a mouthful. I like to break things down. So in my terminology, this is how I understand hormones. Hormones are signaling molecules, okay? They send information from one organ to another in the body. That's my basic definition. Hormones are signaling molecules. They send information from one organ to another in the body. For example, a woman tells her 5-year-old son Billy that Susan is annoying. The 5-year-old Billy tells Susan, Kathy, Megan, Greg, and Nancy, who all have a response. In this case, Billy is the hormone, and the people he told are the target organs. So that's another way you can think of hormones. Billy is the signaling molecule. Susan is an organ, and the people he told are the target organs, okay? Each having a different response. Those are hormones. There are different hormones throughout the body. Let's take a look at them. So the hypothalamus has their hormones. Thyroid and parathyroid glands have its hormones. The liver has its hormones. The adrenal gland and the kidneys have its hormones. The testes have its hormones. The pineal gland produces melatonin. The pituitary gland produces a lot of our hormones. The thymus gland produces a hormone. Stomach produces hormones. These are the hormones that are targeted in semaglutide and trizipatide. Pancreas has its hormones, the ovary and placenta has its hormones, and the uterus has its hormones. So a lot of these glands have their own hormones. They receive signaling from other hormones, and they send signals out to other organs as well. Hormones. The hormones we're going to discuss today are estrogen, progesterone, testosterone, thyroid, cortisol, insulin, and DHEA. Estrogen. So there are 3 components of estrogen in the female body. They have different functions in men, and we'll get to that. But there's 3 different components of estrogen. There's E1 or estrone, and that's involved in breast cancer in men and females. In men and women. And that's a toxic form of estrogen. So that's a toxic form of estrogen. We want that to be as low as possible, right? Then you have estradiol or E2. That's the woman's hormone of vitality, right? The woman's hormone of youth. Estradiol or E2. Then we have estriol or E3 is the pregnancy hormone, and it protects the breast and the uterus. That's estriol. E3 is the pregnancy hormone that protects the breast and the uterus. In ladies, estrogen has over 400 crucial functions and has receptors throughout the body, brain, muscles, bone, bladder, gut, uterus, ovaries, vagina, breast, colon, eyes, heart, lungs, and blood vessels. So this hormone is super important to women. In men, estrogen helps maintain memory, it builds bone, it breaks down cholesterol, and it helps with metabolism. Progesterone. So progesterone balances estrogen. That's the key. Progesterone balances estrogen. Even if you've had a hysterectomy, that does not mean you don't need progesterone anymore. Your body still needs progesterone, even if you don't have a uterus. Yes, when you have a uterus, it protects your breast against breast cancer when you're on hormonal replacement therapy. But just because you don't have a uterus doesn't mean you no longer need progesterone, because it helps balance the estrogen. Okay. I'll say that again. Just because you don't have a uterus doesn't mean you no longer need progesterone. You still need progesterone. It helps balance estrogen. It helps with sleep. It builds bone. It prevents anxiety, irritability, and mood swings. It helps with bladder control. A lot of my menopausal women will have issues with urinary incontinence, and that is because they have estrogen and progesterone receptors on their bladder, and they're not getting enough of either. And they're having issues with urinary incontinence, and they think it's because they have so many kids vaginally or this or that or the other. And it's really the progesterone that they need. It helps with food breakdown in the gut. It lowers bad cholesterol. It promotes healthy brain activity. It's involved with neurotransmitters. It modulates oxytocin to maintain pregnancy. It helps with ovulation. It protects breast health. It promotes implantation of an egg. It's anti-inflammatory. It's a diuretic. It's an immune builder. It increases scalp hair. It increases metabolic rate. It helps the body use and eliminate fats. It relaxes smooth muscle. It helps the thyroid function. It helps restore proper oxygen levels. It promotes immune system. It converts toxic estrogen E1 to non-toxic estrogen E1 sulfate. So you see there, that's how it helps the breast. It converts toxic estrogen E1 to non-toxic estrogen E1 sulfate. That's the key. That's how it balances estrogen, by decreasing the amount of toxic forms of estrone or E1. Progesterone in men is pretty simple. It protects the prostate from enlargement. It's neuroprotective. It's so neuroprotective that in other countries, when people get into car accidents, they give them IV progesterone to help the brain deal with trauma. That's how neuroprotective it is. It's cardioprotective. It helps with sperm production. It helps with sleep. Testosterone in women, it improves bone strength. It decreases excessive body fat. It helps neurotransmitters. It has an antidepressant effect. It increases muscle mass and strength. It maintains memory. It increases muscle tone and prevents sagging skin. It helps with emotional well-being. It helps with self-confidence and motivation. It increases sexual interest. So testosterone in women, you got to be careful, because testosterone in women is produced in very, very minute, very, very tiny amounts. So you don't want to put a testosterone pellet in a woman. They will get chin hair. They will get chest hair. They will get an enlarged clitoris. They will get all types of issues. You want to be very, very careful with how you how you give testosterone in women. You don't want to give it for too long. You want to put them on tiny, tiny amounts. Testosterone in men. So testosterone in men, testosterone is the vitality hormone in men. Okay. But I'm seeing lower and lower testosterone levels in younger and younger men. And it's very concerning. It's very, very concerning, because what we're eating, what we're ingesting, the toxins, the foods, the plastics, all of this is affecting testosterone levels in men. So we definitely have to be careful. We definitely have to be careful with testosterone in men, because it's very concerning to see low levels of testosterone in the 100s and 200s when it should be in the 500s to the 800s in men that are 25 and men that are 30. It's very, very concerning. So testosterone in men helps maintain vision, maintains energy, maintains sexual interest and function, lowers cholesterol, lowers blood sugar, lowers blood pressure, is involved in the making of protein and muscle formation, helps manufacture bone, improves oxygen uptake throughout the body, needed for normal sperm development, regulates acute HPA responses under challenge. So HPA responses are like fight or flight responses. So it helps with the fight or flight response, especially when men come into contact with a specific type of challenge. It helps maintain a powerful immune system. It aids in mental concentration. It improves mood. It helps protect the brain against Alzheimer's disease. It regulates thromboxane A2 receptors on megakaryocytes and platelet aggregation. That just means that it helps block. It helps block. It helps with the coronary arteries that are trying to be blocked for a heart attack. It helps with that blocking process, right? So you want your coronary arteries to be open and full of blood, flowing fully with no issues. So when men take testosterone, it helps have that flow of blood through the coronary arteries as good as possible. Thyroid. So thyroid does a lot of different things. I couldn't put everything the thyroid does on one slide, but I just wanted to do the main points. So it affects tissue repair and development. It aids in mitochondria, or the source of power for the cell, and energy. It assists in digestion. It controls hormone excretion. It controls oxygen utilization. It modulates blood flow. It modulates carb, protein, and fat metabolism. It modulates muscle and nerve action. It modulates sexual function, and it regulates vitamin usage. So it does a lot. Cortisol. Cortisol is the fight or flight response of a person's body. It is your stress hormone. It increases when you're under stress. It does a lot of different things, and it helps try to dampen that stress response. The issue with cortisol is that it's a sugar, and it will increase your blood sugar. So that's why we see in the hospital when people are in the hospital, they're under a lot of stress, they're fighting for their lives, their cortisols will usually be elevated. And when the cortisol is elevated, their blood sugar will also be elevated, and it makes it harder to manage their blood sugars. So cortisol regulates the bone turnover rate. It regulates the immune system response. It regulates the stress response. It balances blood sugar. It controls weight. It helps with protein synthesis. It aids in sleep. It improves mood and thoughts. It is anti-inflammatory. Insulin. So insulin regulates blood sugar levels. It provides energy. It stores glucose. It promotes protein synthesis, and it inhibits fat breakdown. I feel like insulin gets a bad rap because it's very, very important. But what you don't want to be is you don't want to be insulin resistant. So if I were to eat something, my insulin would increase, and it would allow me to bring the blood sugar into my cells to use it for energy. If somebody who is a diabetic or pre-diabetic or insulin resistant eats something, they may produce a little amount of insulin, and that's not enough to bring the blood sugar into their cells. Or they may produce a large amount of insulin, but their body doesn't respond to the insulin, and that's still not enough to bring the blood sugar into the cells. The result is high blood sugar in the blood, and that's what caused prediabetes, diabetes, and insulin resistance. DHEA. So DHEA is a new hormone on the block. It was just recently discovered, and it does a lot of different things. It works out of the adrenal glands, so it works with the adrenals, and it does a lot of good things. It lowers cholesterol. It decreases allergic reactions. It decreases the formation of fatty deposits. It helps the patient deal with stress. It helps the body repair itself and maintain tissues. It increases bone growth. It increases cognition or brain function. It increases lean body mass. It increases sense of well-being. It lowers triglycerides. It prevents blood clots. It promotes weight loss. It reduces spikes in blood sugar. It decreases the rate of insulin resistance. It supports the immune system. It increases growth hormone levels. It prevents blood sugar from being added to the cells. And that's just advanced glycation end product formation. So when the blood sugar gets super, super high in the body, it starts to add to the cells and cause DNA breakage and damage. DHEA stops that process. It's an antioxidant, it's anti-inflammatory, and it increases nitric oxide. Where do hormones come from? So they come from the pituitary gland in the brain. It comes from the hypothalamus gland in the brain, the thyroid gland, the parathyroid gland, the adrenal glands, the pancreas, the gonads, the pineal gland, the thymus, the fat cells, and the gut. What regulates hormones? So negative feedback. Billy screams. Mom screams louder at Billy. Billy stops screaming. Example, T3, T4 rise in the thyroid in the brain. T3, T4 rise in the thyroid. TSH in the brain will rise higher to try and shut them off and decrease them to their normal level. So that's negative feedback. Hypothalamus and pituitary gland. The hypothalamus regulates the hormones and the pituitary produces the hormones. The regulation occurs mostly through negative feedback, except oxytocin. So oxytocin occurs through positive feedback, and that's the hormone that is used to push a baby out. So when a mom is in labor and she's trying to push a baby out, oxytocin will increase and increase and increase even more until the baby is out. That's how it works through positive feedback. There are glands and organs that also regulate hormone, like the thyroid, adrenals, the pancreas, and the stomach. How do hormones get out of balance? So hormones get out of balance through a number of different things can cause, and I put a list here of the main things that are causing people's hormones to get out of balance. Things that you may not think about on a daily basis, but things that are actually affecting your hormones a lot. Okay. Nutrition. So we have a population in America, a overweight and obese population that is very malnourished. So we're taking in a lot of calories, but the calories that we're taking in is not nutritional. That's an issue. Chemicals in our products of our hair, chemicals in our makeup, chemicals in our skincare products, chemicals in our food. Okay. Toxins, same. Toxins everywhere we look, there's toxins put into everything that we deal with and manipulate. Other hormones. So other hormones can actually have your hormones be out of whack. Things like phytoestrogens. Okay. That's things that are similar to estrogen that we see in milk products or dairy products. We also see that in soy. So soy has a lot of phytoestrogens, and that can mess up other hormones. Micronutrient deficiencies. So we see things like zinc and selenium affecting the thyroid function, and those can get the hormones out of balance. Medications can also get the hormones out of balance. Aging, stress, radiation, endocrine disruptors like the phytoestrogens, perfume, fragrance, chemotherapy, water, fluoride, pesticides, plastics or microplastics, mold, gasoline, air, water pollution, phytoestrogens, phthalates, BPA or parabens. These also get the hormones out of balance. What are the pathological states of hormone imbalance? So menopause. I'll say this a million times if I have to. Just because menopause is natural does not mean menopause is healthy. Menopause is not healthy for you at all. It's an inflammatory condition, and it must be treated correctly and appropriately. So menopause can cause acne, joint pain, low energy, anxiety, arthritis, aging skin, brittle hair and nails, oily skin, chronic fatigue, bone loss, decrease in breast size, panic attacks. A lot of women think they have mental health issues. They don't have mental health issues. It's really just menopause. Diabetes, insulin resistance, weight gain around the middle, difficulty losing weight, thinning hair, hypertension, heart disease, vaginal dryness, weight gain, facial hair, decrease in dexterity or strength, decrease in memory and focus or cognitive impairment, okay? Decrease in sexual interest or function, restless sleep, depression, thinner skin, urinary incontinence, leakage, and infertility. So menopause solutions. Like I said, menopause is pro-inflammatory and must be treated sooner rather than later. To get the heart benefits and the bone benefits, get with your doctor about doing hormonal testing. Quest and LabCorp will not do it. Look into ZRT, Dutch, and Genova testing. So non-hormonal solutions to menopause is black cohosh, ashwagandha, omega-3 fatty acids, and you need a pharmaceutical grade omega-3 fatty acid. Dong quai or female ginseng, vitamin D3 or K2 and K2. You need the K2. The reason why you need K2 and vitamin D, so that vitamin D increases your calcium. When you have the increased calcium, if you don't take K2, that calcium will go to your heart and cause plaques in your heart. You don't want that. So you take the K2 to push that calcium into your bones. You have evening primrose oil, zinc and copper, soy isoflavones also help with menopause. Hormonal options are bias like estradiol E2 plus estriol E3. Progesterone, even without a uterus, you still need progesterone. Testosterone in small amounts, and DHEA if needed. What are the pathological states of hormone imbalance? So you have in men, you have andropause, hypogonadism, fatigue, tiredness, loss of energy, depression, lower negative mood, irritability, anger, bad temper, weight gain, backache, joint pains or stiffness, decline in physical abilities, elevated cholesterol, increased risk of heart disease, feeling overwhelmed, decrease in job performance, osteoporosis, osteopenia, and loss of fitness. Andropause solution. So testosterone levels in a man start to fall off in their 40s. Not all men become testosterone deficient, but it is inevitable for most men. Before getting erectile dysfunction medication, look into checking your hormones, testosterone, estrogen, prolactin, etc. Right? So you need to check your hormones before you get on Viagra, before you get on Cialis. Check the hormones first. Non-hormonal options: zinc, copper, ashwagandha, American ginseng, fenugreek, vitamin D3 plus K2. I had a patient, he thought he had ED, erectile dysfunction. He did not. He had vitamin D deficiency. So vitamin D deficiency can cause erectile dysfunction. There are studies out there linking vitamin D deficiency to erectile dysfunction. I put him on vitamin D3 and K2. He got better. He said he never felt his sex life improved. His wife was happy. He was happy, and he didn't even need the Viagra. Hormonal solution, testosterone, chrysin. So chrysin stops the testosterone from being converted into estrogen and causing the man boobs. So I know men don't want to have boobs. So I put a little chrysin in there. I get it compounded, and I put a little chrysin and testosterone. HCG or growth hormone can help. Clomid can help. What are the pathological states when it comes to thyroid? Okay. So with Hashimoto's or low thyroid, you can get a lot of different things. I'm going to give you a small list of them: allergies, bladder or kidney infections, carpal tunnel, congestive heart failure, easy bruising, endometriosis, gallstones, high blood pressure, bipolar or schizophrenia, literally from low thyroid. Ringing in the ears, poor night vision, elevated liver enzymes, osteopenia, osteoporosis, urinating at night, arthritis, heavy menstrual cycle or PMS, paresthesias, that's tingling in the hands and tingling in the feet, swollen eyelids, slow speech, sleep apnea, insomnia, inability to concentrate, asthma. What about when the thyroid is too high or Graves' disease, right? Early symptoms include anxiety, nervousness, irritability, brittle fingernails, breast enlargement in males, bulging eyes, constipation, diarrhea, diabetes, increased heart rate, chest pain, erectile dysfunction, goiter, palpitations, heat and cold intolerance, muscle weakness, personality changes, diaphoresis, oncholysis, that is where your nails start to break down, or chip, and lice, which means break apart. Shortness of breath, skin changes, trembling, weight changes. Late symptoms include hearing loss, hoarseness, thick and red skin. Thyroid solutions. For Hashimoto's or low thyroid, the zinc copper balance is key. You got to get your zinc and copper checked. Detox protocols, checking iodine levels always. Oral contraceptives, estrogen, and beta blockers can lead to thyroid disorders. So when you're on hormonal therapy, it's so important to be on a good multivitamin to help prevent this. A good multivitamin will help prevent thyroid issues when you're on hormonal treatment. Toxins like lead, mercury, and pesticides. Excessive cell phone use can lead to Hashimoto's. Graves or high thyroid Again, zinc and copper balance is important. Always check iodine levels with Graves or high thyroid. Excessive iodine can cause Graves' disease. Pregnancy, medications like amiodarone or lithium can cause Graves. Infection can cause Graves. What are pathological states of hormone imbalance as it relates to the adrenal glands? Well, when you have adrenal insufficiency, you're at risk for alcohol and drug abuse. You're at risk for allergies, decreased immunity, decreased sexual interest, digestive problems, emotional imbalance, emotional paralysis, fatigue, feeling overwhelmed, feeling unwell, hypoglycemia, PCOS, PMS, perimenopausal, menopausal, andropause, lack of stamina, loss of motivation or initiative, low blood pressure, poor wound healing, poor athletic performance, sensitivity to light, and unresponsive hypothyroidism. So a lot of times when you're not responding to your thyroid medication, that's because you're too stressed. Your adrenals are out of whack. Your cortisol levels are super, super low. So you definitely need to look into your cortisol levels and adrenal insufficiency if your thyroid medication is not working for you. Cushing's syndrome. So that's the opposite. That's when your cortisol is too high, okay? Cortisol way too high. And like I said, it's a sugar. So you start to get the effects of diabetes and insulin resistance because of that. Binge eating, confusion with Cushing's syndrome, fatigue with Cushing's syndrome, impaired liver conversion of T4 to T3, that goes back to your thyroid, hypertension or high blood pressure, elevated blood sugar, insulin resistance, high cholesterol, triglycerides, osteopenia, osteoporosis, increased bruising, increased risk of infections, irritability or low energy, night sweats, tremors in between meals, sleep disturbances, sugar cravings, thinning skin, weakened muscles, and compromised immune system, all with elevated cortisol levels or Cushing's syndrome. Cortisol solutions. So if you have adrenal insufficiency, it's important to get a good multivitamin, stress reduction, meditation, yoga, prayer, space breathing, whatever helps for you. Adaptogenic herbs like ashwagandha and rhodiola help tremendously to calm you down. Excuse me. Cushing's syndrome, a multivitamin, also adaptogenic herbs like cordyceps and ginkgo biloba will also help tremendously. What are the pathological states as it relates to cancers? So breast cancer, uterine cancer, ovarian cancer, those are all estrogen related cancers, and they are predominated by E1 or estrone or the toxic form of estrogen. High levels of this type of estrogen can bind to cancer cell receptors and lead to cancer growth and division. It is very important that if you're on estrogen, you get estrogen metabolism labs to make sure your estrogen is being broken down correctly and not into E1 or estrone. Prostate cancer. Prostate cancer depends on testosterone to grow, and extremely high levels of testosterone can facilitate growth of present cancer cells in the prostate. A deficiency in progesterone in men can cause prostate enlargement, and there are some prostate cancers that are stimulated by progesterone. So that's why you have to get it checked. So deficiency can cause prostate enlargement, and there are some cancers that are stimulated by progesterone. That seems like it's contraindicating, but if you read it correctly, I say progesterone in men can cause prostate enlargement, and some prostate cancers are stimulated by progesterone. Cancer solutions for female cancers: metformin, curcumin, and melatonin. For prostate cancer or male cancers, metformin and curcumin are very good solutions. Resistant, so now we're talking about the pancreas. So we have resistant hypoglycemia and insulin resistance. So resistant hypoglycemia can cause shakiness or trembling, sweating, dizziness or lightheadedness, confusion or difficulty concentrating, anxiety or irritability, headache, blurred vision, rapid heartbeat, hunger, weakness, and nausea. Insulin resistance can cause fuzzy brain, infertility, irregular menstrual cycles, irritability, loose bowel movements with alternating constipation, and water retention and weight gain. Insulin solutions, resistance hypoglycemia, you got to eat a high protein diet, start your chromium probiotics. And insulin resistance, chromium, alpha lipoic acid, magnesium, vitamin D3, berberine, ginseng, fenugreek, bitter melon, and there's so many others for insulin resistance, including nutrition. Don't ever forget nutrition. So how do you balance hormones? So the key to balancing hormones is going to be detoxification, helping your colon, helping your liver, helping your kidneys. Also help those organs eliminate, right? To help your liver, you can take milk thistle or lemon water. For your kidneys, magnesium glycinate or electrolyte rich food and liquids, cordyceps mushrooms, bilberry helps with kidneys. For your gut, digestive enzyme and pre and probiotics. Get your hormones and nutrients checked. Replace nutrients. Start with food. So for menopause, chickpeas, soy, spinach, kale, dandelion greens, watercress, berries, and flax seeds help tremendously with menopause. Start resistance training. For women, proteins like arginine, leucine, and glutamine help a lot. Supplements like ashwagandha, red clover, and black cohosh help a lot. For andropause, leafy greens, antioxidant-rich berries, lean meats, avoid fried foods and vegetable oils, cut out the processed sugar, and you want to do cardio overweight training for men. Vitamin D, zinc, and saw palmetto will help with andropause tremendously. You want to increase zinc and copper in both sexes. For women, there's always bias cream patches and low-dose testosterone if needed. For men, testosterone cream or injection plus the aromatase inhibitor chrysin to help with not developing the man boobs. So what is Prosper Direct Primary Care? Prosper Direct Primary Care is a new model of medicine in which you pay your doctor a low monthly fee in exchange for unlimited visits, 30 to 60-minute appointments, and discounted meds, labs, and imaging. It's a new model. It's the model of the future. This is healthcare and medicine, right? Not paying insurance companies. I do not bill insurance companies. I do not want to be in partnership with insurance companies. This is direct care to you from your doctor. And this is how medicine was in the past. And this is how medicine should be in the future. My name is Dr. Elizabeth Kolawole. Thank you so much. I appreciate everything. Thank you so much for your time. Have a wonderful day.